Checking blood sugar readings brings daily frustration. Despite following medication schedules perfectly, numbers remain stubbornly high. The disappointing cycle continues despite best efforts. What many people with diabetes never discover is that certain foods actively lower blood sugar within hours of consumption. These natural, accessible options work alongside prescribed treatments to enhance results dramatically. 7 powerful foods contain unique compounds that specifically target glucose metabolism. Some people experience noticeable improvements within 24 hours, though consistent use provides most significant benefits. Remember to consult healthcare providers before making significant dietary changes, especially when taking medications. Powerful food number 1: cinnamon, the blood sugar balancer. Not all cinnamon provides equal blood sugar benefits. Ceylon cinnamon, often called true cinnamon, offers the most powerful glucose-lowering effects, with fewer side effects than the more common cassia variety found in most grocery stores. The distinction matters particularly for long-term use. Cinnamon contains specialized compounds called polyphenols that remarkably mimic insulin action within cells. These compounds activate cellular receptors, allowing sugar to move from bloodstream into cells more efficiently, essentially performing a similar function to the body's natural insulin, but through different pathways. Research published in Diabetes Care examined 60 type 2 diabetics who consumed cinnamon daily for 40 days. Participants experienced average blood glucose reductions of 24% compared to control groups. Multiple subsequent studies confirmed these findings, particularly for fasting blood sugar levels. The glucose-lowering effects begin within hours of consumption, though consistent daily use provides more substantial and reliable results. Most people notice meaningful improvements within 7 to 10 days of regular consumption. The ideal therapeutic amount equals approximately 1/2 to 1 teaspoon daily, delivering benefits without excessive doses. This modest amount makes incorporation simple and affordable. Practical methods for daily consumption include sprinkling cinnamon on morning oatmeal, blending into coffee grounds before brewing, adding to plain yogurt, or incorporating into savory dishes like chili and curry. For those disliking the flavor, cinnamon supplements provide an alternative. Certain individuals should exercise caution with cinnamon, particularly those taking blood-thinning medications or with liver concerns, as concentrated amounts may interact with these conditions. Richard from Ohio discovered cinnamon after struggling with morning glucose readings averaging 187 milligrams per deciliter despite medication. After adding 1 teaspoon daily to his morning coffee for 2 weeks, his morning readings decreased to averaging 154 milligrams per deciliter, a significant improvement without medication changes. Powerful food number 2: apple cider vinegar, the mealtime glucose shield. Apple cider vinegar contains acetic acid that works through a remarkable mechanism to lower blood sugar. This compound temporarily blocks enzymes responsible for breaking down complex carbohydrates into simple sugars during digestion. This blocking action means starches convert to glucose more slowly, preventing the rapid blood sugar spikes that damage the diabetic body. Timing significantly impacts effectiveness. Research demonstrates consuming apple cider vinegar 15 to 30 minutes before carbohydrate-containing meals provides maximum blood sugar protection. This pre-meal timing allows the acetic acid to be present in the digestive tract precisely when needed. Studies published in Diabetes Care showed that consuming apple cider vinegar before a high carbohydrate meal reduced post-meal blood glucose by 19 to 34% compared to placebo groups. Sandra from Florida struggled with post-dinner glucose levels reaching 220 milligrams per deciliter despite medication. After implementing a pre-dinner apple cider vinegar routine, her post-meal readings decreased to averaging 175 milligrams per deciliter within 1 week. She created a palatable ritual by mixing 1 tablespoon with sparkling water and lemon before meals. Safety requires proper dilution. 1 to 2 tablespoons mixed into at least 8 ounces of water prevents potential damage to tooth enamel and esophageal tissues. Never consume undiluted vinegar. Creative incorporation methods include using apple cider vinegar in homemade salad dressings, adding to cooking water for rice to lower the resulting glycemic impact, or creating a pre-meal drink with water, lemon, and optional cinnamon. Typical blood glucose reductions range from 20 to 40 points after high carbohydrate meals when vinegar is consumed beforehand, with effects lasting approximately 1 to 2 hours. People with gastroparesis, acid reflux, or potassium-lowering medications should consult healthcare providers before using this approach. Powerful food number 3, leafy greens, nature's insulin sensitizers. Among leafy vegetables, specific varieties demonstrate superior glucose-lowering effects. Spinach, kale, arugula, and Swiss chard lead this category due to their exceptionally high concentrations of bioactive compounds. When selecting these at your local grocery market, darker leaves generally indicate higher potency. Magnesium content explains much of their effectiveness. This critical mineral serves as a cofactor for more than 300 enzymatic reactions, including those regulating insulin function and glucose metabolism. Most people with diabetes show suboptimal magnesium levels, and leafy greens provide this mineral in a highly bioavailable form. Nitrates naturally present in leafy greens convert to nitric oxide in the body, improving blood vessel dilation and circulation. This enhanced blood flow allows insulin and glucose to reach target tissues more efficiently, improving overall metabolic function. Thomas from Michigan incorporated one large spinach salad daily after his prediabetes diagnosis. His fasting blood sugar averaged 142 milligrams per deciliter before this change. After 6 weeks of daily leafy green consumption, his morning readings decreased to averaging 119 milligrams per deciliter, moving him out of the diabetic range without medication. Regular consumption typically reduces fasting blood sugar by 10 to 20 milligrams per deciliter over several weeks, with benefits accumulating over time. Light steaming or quick sautéing preserves more active compounds than prolonged boiling. Raw consumption maximizes enzyme content, though briefly cooking certain varieties like spinach increases the bioavailability of other nutrients. The ideal therapeutic portion equals approximately 2 to 3 cups daily, divided between meals. Most people notice initial improvements within 10 to 14 days of consistent consumption. Powerful food number 4, berries. The antioxidant blood sugar defenders. Among berry varieties, blueberries, strawberries, and blackberries demonstrate the most powerful effects on glucose metabolism. These small fruits contain concentrated, bioactive compounds that actively target insulin pathways. Anthocyanins, the pigments giving berries their vibrant colors, improve insulin signaling within cells. These compounds activate cellular pathways that mimic insulin action, enhancing glucose uptake from bloodstream into muscle tissue. Research indicates anthocyanins may help regenerate pancreatic cells that produce insulin. Berry fiber creates a gel-like matrix in the digestive tract that significantly slows glucose absorption. This action prevents rapid blood sugar elevations after meals while supporting digestive health. Elizabeth from Colorado incorporated 1 cup of mixed berries daily after her type 2 diabetes diagnosis. Before making this change, her post-breakfast glucose levels typically reached 190 milligrams per deciliter. After 3 weeks of adding berries to her breakfast, these readings decreased to averaging 145 milligrams per deciliter without medication changes. Her fasting glucose also improved gradually over several months. Fresh and frozen berries provide nearly identical benefits. Frozen varieties often contain higher antioxidant levels since they are flash frozen at peak ripeness. This makes year-round consumption both practical and economical. Optimal timing occurs either 15 minutes before a meal or mixed with protein-rich foods during the meal. The ideal therapeutic portion equals approximately 1 cup daily, divided into 2 servings if preferred. Creative serving suggestions include topping plain Greek yogurt with berries, adding to overnight oats, blending into smoothies with protein powder, or creating berry-infused water as a refreshing alternative to sugary drinks. Clinical research published in the Journal of Nutrition showed that daily berry consumption over 12 weeks reduced hemoglobin A1C levels by approximately 0. 5% in diabetic study participants. Powerful food number 5. Nuts. The metabolic regulators. Among various nut varieties, almonds, walnuts, and pistachios demonstrate the strongest research support for blood sugar management. These particular nuts contain specialized compounds that directly impact glucose metabolism through multiple pathways. The healthy monounsaturated and polyunsaturated fats in nuts improve cell membrane function, enhancing insulin receptor sensitivity. This improved cellular response allows insulin to work more effectively, even when production is limited. Nuts provide concentrated sources of magnesium and chromium, two minerals directly involved in glucose regulation. Magnesium serves as a cofactor for enzymes in the insulin signaling pathway, while chromium helps the hormone bind more effectively to cell receptors. Portion control remains essential as nuts provide concentrated calories. The ideal therapeutic amount equals approximately 1 to 2 ounces daily, equivalent to about 20 to 24 almonds or 14 walnut halves. Michael from Texas incorporated a small handful of mixed nuts each evening after struggling with stubborn morning hyperglycemia. Before this habit, his waking glucose typically measured 165 milligrams per deciliter despite medication. After 3 weeks of evening nut consumption, his morning readings decreased to averaging 142 milligrams per deciliter consistently. His physician noted this improvement occurred without any other dietary or medication changes. Consuming nuts approximately 15 to 20 minutes before carbohydrate-containing meals significantly reduces the resulting glucose spike. Research shows this simple timing strategy can lower post-meal blood sugar by 20 to 30% compared to eating carbohydrates alone. Regular nut consumption provides sustained benefits beyond immediate glucose control. Studies demonstrate improved hemoglobin A1C levels and reduced cardiovascular risk factors after 3 to 6 months of consistent intake. Proper storage in airtight containers away from heat and light prevents oxidation of delicate oils. Refrigeration extends freshness significantly, particularly for walnuts with their higher omega-3 content. Powerful food. Number 6. Chia seeds. Chia seeds contain exceptional levels of soluble fiber that transforms dramatically when exposed to liquid. This fiber creates a thick gel that forms a physical barrier in the digestive tract, significantly slowing carbohydrate breakdown and subsequent glucose absorption. This mechanism prevents the rapid blood sugar spikes that damage diabetic bodies. This gel-forming action explains why chia seeds reduce post-meal blood sugar elevations by 20 to 40% when consumed before or with carbohydrate-containing meals. The effect typically lasts 2 to 3 hours, providing extended protection during the critical digestion period. Chia seeds also contain substantial omega-3 fatty acids that reduce inflammation throughout the body. This anti-inflammatory effect improves cellular insulin sensitivity over time, addressing a root cause of type 2 diabetes. Jennifer from Arizona discovered chia seeds after struggling with post-meal glucose spikes despite medication. Her levels typically reach 210 milligrams per deciliter after breakfast. After incorporating 1 tablespoon of chia seeds into her morning routine for 2 weeks, her post-breakfast readings decreased to averaging 165 milligrams per deciliter. She particularly noticed that morning brain fog diminished significantly as her glucose stability improved. Proper preparation maximizes benefits. Chia seeds should soak for at least 10 minutes before consumption, allowing the gel to form completely. This pre-soaking step significantly enhances their blood sugar moderating effect. The recommended therapeutic portion equals 1 to 2 tablespoons daily, divided between meals if desired. Evening consumption creates particularly beneficial overnight effects, often improving morning fasting glucose readings. Creative incorporation methods include stirring into yogurt, blending into smoothies, making simple chia puddings, or sprinkling pre-soaked seeds onto salads. The mild flavor adapts easily to both sweet and savory applications, making daily consumption simple. Powerful food number 7. Fatty fish, the inflammation fighters. Specific fish varieties provide exceptional omega-3 fatty acid concentrations that directly benefit blood sugar management. Wild salmon, mackerel, sardines, and herring contain the highest levels of these beneficial compounds, with wild Alaskan salmon offering the optimal balance of omega-3 content and low environmental contaminants. Chronic inflammation directly impairs insulin function by interfering with cellular signaling pathways. The specialized omega-3 fatty acids in fish, particularly EPA and DHA, reduce this inflammation through multiple mechanisms. As systemic inflammation decreases, insulin receptors function more efficiently, improving glucose uptake throughout the body. The high-quality protein in fatty fish provides additional blood sugar benefits by triggering minimal insulin release while promoting satiety. This protein helps stabilize blood glucose levels between meals and reduces overall carbohydrate cravings. Robert from Massachusetts incorporated wild salmon twice weekly after his type 2 diabetes diagnosis. Before this dietary change, his fasting glucose consistently measured 165 milligrams per deciliter despite medication. After 8 weeks of regular fatty fish consumption, his morning readings decreased to averaging 138 milligrams per deciliter. His physician noted significant improvements in his inflammatory markers as well. For sustained benefits, consuming fatty fish 2 to 3 times weekly provides optimal results. Most people notice initial improvements in post-meal glucose readings within 10 to 14 days, while inflammatory markers typically show significant changes after 4 to 6 weeks. Gentle cooking methods best preserve beneficial compounds. Baking, poaching, or light grilling prevents damage to delicate omega-3 fatty acids. Avoid high-temperature frying, which can degrade these beneficial compounds. While fish oil supplements provide some benefits, research consistently demonstrates superior results from whole food consumption. The complete nutrient profile in whole fish, including protein, selenium, and vitamin D, works synergistically with omega-3s for enhanced metabolic effects. Strategic implementation plan, making these foods work together. Begin by introducing just one new food every 3 days, rather than attempting complete transformation. Morning routines incorporate cinnamon and chia seeds easily. Midday meals provide perfect opportunities for leafy greens and nuts. Evening meals accommodate fatty fish and vinegar preparations. The most powerful combinations include cinnamon with chia seeds for breakfast and leafy greens with vinegar dressing for lunch. Budget-conscious approaches include frozen berries, canned wild salmon, and bulk nut purchases. Track individual food effects using a simple food journal alongside glucose readings to identify your personal power foods. Common obstacles include preparation time and taste preferences. Overcome these through weekend batch preparation and gradual palate adaptation. Most people notice significant improvements within 14 to 21 days of consistent implementation. Conclusion: these 7 powerful foods, cinnamon, apple cider vinegar, leafy greens, berries, nuts, chia seeds, and fatty fish, offer natural blood sugar regulation through different but complementary mechanisms. The combined approach creates comprehensive metabolic support. Consistency ultimately determines success with these foods. Daily incorporation provides substantially better results than occasional use. Begin your journey with just 1 or 2 options that appeal most. Cinnamon and berries often provide the simplest starting point with noticeable effects. Share your personal experiences with these foods in the comments section below. Subscribe for more practical diabetes management strategies.